we're looking at the radiological signs in obstetrics. So under this, first being the Beagle sign. A Beagle sign, it is seen in unruptured tubal ectopic pregnancy, also known as tubal ring sign or blob sign. So how it appears, there is appearance of an echoic gestational sac in adnexa, and it is surrounded by hyperechoic ring. Next, looking at the twin peak sign. Twin peak or the lambda sign. In twin peak and lambda sign, it is seen in cases of dichorionic twins. There is thickening of the triangular projections of placental tissue, and this takes place between the two gestational sacs. Looking at the next sign, it is called the T sign, and T sign, it is seen in monochorionic diamniotic gestation. It is thin and T-shaped. There is no extension of placenta tissue or chorion, so there is no extension of placental tissue or chorion in between amniotic membrane moving on to the double decidual sac sign. So in such a sign, there is early intrauterine pregnancy. There is presence of two concentric echogenic rings, and this surrounds the gestational sac. Next, there's presence of the lemon sign. In case of the lemon sign, at the level of lateral ventricles, there is inward bowing or scalloping of frontal bones, and this gives rise to the lemon sign, and it's suggestive of spina bifida, and it is associated with the Chiari 2 malformation. Next, looking at the banana sign, it is the anterior curvature of cerebellum, and it with the effacement of the cisterna magna in posterior fossa and is seen as banana sign. Next, the Spalding sign. It appears after 7 days of intrauterine death. It is caused by liquefaction of the brain matter and softening of ligamentous structures. It leads to irregular overlapping of cranial bones. Next, looking at the frog eye sign. Frog eye sign, it is seen in anencephaly and it is due to the absence of calvaria. The orbits appear prominent and it is known as frog eye sign. Next, Homeward Seal. It is a congenital midline abdominal wall defect and it's at the base of umbilical cord insertion. There's herniation of solid abdominal viscera or bowel out of the abdominal wall, fetal abdominal wall, and the contents that are excluded, it is covered in a sac. Looking at next, it is the double bubble sign. It refers to the dilation of the stomach and the first part of duodenum, and this is due to the duodenal atresia. Next, looking at the bunch of grape sign or snowstorm appearance. This is due to the appearance of multiple cystic lesion spaces or lesions in a complete mole. Next, looking at the ball sign. In ball sign, it is due to the crumpled up sign of the fetus seen in case of the IUD, that's intrauterine death. Looking at the Robert sign. In case of Robert sign, there's presence of gas in the fetal great vessels in case of intrauterine fetal demise. The stuck twin sign. In case of the stuck twin sign, there is smaller twin is held in fixed position. That is a smaller twin. along the uterine wall, and this is due to severe oligohydramnios. Next, looking at the butterfly sign. Butterfly sign, there is normal appearance of choroid plexus is normal, and this is on axial imaging of fetal brain. Next, there is absence of sign it suggests the holoprosencephaly. Next, the cloverleaf skull, it is seen in craniosynostosis. Looking at the empty anion sign, it is nothing but the visualization of the amniotic sac, and this is without concomitant visualization of the embryo. So it's without the concomitant visualization of the embryo, and it is an indication of the pregnancy failure.